Prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do and why it is necessary and how or she can participate. Inform the client that the sanctioning will relieve breathing difficulty and that the procedure is painless, but may be uncomfortable and stimulate the cough, gag, or sneeze reflex. After that, you should perform hand hygiene and observe other appropriate infection prevention procedures. So on this part, I've already done performing hand wash. Provide privacy for the patient. Position client in a semi-follower position. Place the towel or moisture-resistant pad over the pillow or under the chin. Set up sterile containers and pour sterile saline into the sterile container. Don sterile gloves. Prepare the equipment. You should turn on the suction device and set to appropriate negative pressure the suction gauge. The amount of negative pressure should be high enough to clear secretions but not too high. Pick up the suction catheter with your dominant hand and attach it to the connection tubing. To suction, put the tip of the suction catheter into the sterile container of a saline solution and suction a small amount of saline solution through the suction catheter. Apply suction by placing a finger over the suction control port. You should know the approximate the depth to which you will insert the suction catheter. For the oropharyngeal suctioning, you should measure the distance between the edge of the patient's mouth and the tip of the patient's earlobe. Perform suctioning. Apply your finger to the suction control port to start suction and gently rotate the catheter. Apply suction for 5 to 10 seconds while slowly withdrawing the catheter. Then remove your finger from the control and remove the catheter. A suction attempt should last only 10 to 15 seconds during this time. The catheter is inserted, the suction applied and discontinued, and the catheter removed. Rinse the catheter and repeat suctioning as above if necessary. Rinse and flush the catheter and tubing with sterile water or saline. Lubricate the catheter and repeat suctioning until the air passage is clear. Allow sufficient time between each suction for ventilation and oxygenation. Limit suctioning to 5 minutes in total. Encourage the client to deep breathe and cough between suction and use of supplemental oxygen if appropriate. Obtain a specimen if required. Turn off the suction machine and dispose of the catheter gloves, water, and waste container. Coil the suction catheter in your dominant hand. Pull the sterile gloves off over the coiled catheter. Alternately, wrap the catheter around your dominant glove hand and hold the catheter as you remove the glove over it. Now discard the glove containing the catheter in a biohazard receptacle designated by your agency. Empty and rinse the suction collection container as needed or indicated by protocol. Change the suction tubing and container daily. Promote client comfort. Offer to assist the client with oral or nasal hygiene. Assist the client to a position that facilitates breathing. Dispose of equipment and ensure availability for the next section. And lastly, perform hand hygiene. After auscultating the client's breath sounds to ensure they are clear of secretions, observe skin color, dyspnea, level of anxiety, and oxygen saturation levels. For the evaluation, conduct appropriate follow-up such as appearance of secretions, suction, breath, sounds, respiratory rate, rhythm and depth, pulse rate and rhythm, and skin color. Compare findings with previous assessment data if available. Report significant deviations from normal to the primary care provider. Document the date, time, and reason you perform suctioning. Note the color consistency and odor of secretions. Document the patient's tolerance of the procedure and any complication that occurred as a result of the procedure with resulting interventions. So for the documentation, document relevant data, record the procedure, the amount of consistency, the color, and the odor of sputum, especially the foamy white mucus, thick gritting mucus or the blood-flecked mucus, and the client's respiratory status before and after the procedure. This may include the lung sounds rate and character of the breathing and oxygen saturation. If the procedure is carried out frequently, especially every hour, it may be appropriate to record only once at the end of the shift. However, the frequency of suctioning must be recorded. Good day, ma'am. So for the nasopharyngeal and nosotracheal suctioning, so we will just state here at the end of the video. So first is we need to lubricate the catheter with the tip with the water soluble lubricant using your dominant hand. So it depends whether it is left side or your right side. So using your dominant hand, gently but quickly inserting the suction catheter into the nares. So after that, we should advance the suction catheter aiming downward to the premature distance, usually 30 to 15 centimeter in adult, and being careful not to force the catheter. If you meet resistance, you may need to try the other nares. So after that, we will perform the suctioning. So right now, apply your fingers to the suction control port. Again, to start the suction and gently rotate the catheter. So apply the suction for 5 to 10 seconds while slowly withdrawing the catheter. Then remove your fingers from the control and remove the catheter. Right? So a suction attempt should last only 10 to 15 seconds during the procedure. Again, same as like with the oropharyngeal. And we should rinse the catheter and repeat the suctioning as above if necessary. So rinse and flush the catheter in tubing with sterile water or saline solution. So we should also lubricate the catheter and repeat the suctioning until the air passage is clear. So that it will allow sufficient time between each suction for ventilation and oxygenation. So we should limit suctioning to 5 minutes in total. Encourage the client to breathe deeply into cough between the suction. Use the supplemental oxygen if appropriate. And lastly, obtain a specimen if required. Thank you.